I'm going to pile on a little bit to Lisa, but go into a little bit more detail about some of the things that she talked about. Not talk about research and not talk about all of the educational activities we've had. Try to go over very quickly, and it's going to seem like maybe jumping around a bit, but very quickly going over some of the activities that have happened, some of the structure and activities that have happened since May of last year, and really focus on or talk about and hopefully have some questions about what we've learned and what the next steps are. Because we've got PED, we've got Delta Corona, we've got a lot of viruses. We've got too many viruses that are Chinese origin right now, and I want to give a little bit of an overview of what our plans are through this summer in order to try to figure out some of that puzzle. Organization-wise, when we found out about PED, we formed a number of groups, and Lisa presented some of the results of those groups, but I want to make sure that you have a view of all of the things that have happened within each one of them. So the PED Strategic Task Force, multiple entities on that task force, because what we wanted to do was make sure that we got perspectives from all of the stakeholders, all of the players in this thing. That PED Strategic Task Force has had weekly calls since May, and it is that. It's a strategic task force, not so much about details of activities, but where should we be going next, and with the representatives from all of those. And again, as Lisa said, NPPC, AASV, and the Port Board have been in partnership for this thing from the start, and thanks to USDA, the diagnostic labs, SAHOs, the rest of those that have participated on this to help guide where we go. Part of the outcome of that group are the 3 working groups that we put together in the summer of last year to talk about keeping it off the farm, biosecurity, keeping it on a positive farm, biocontainment, and this Packer Biosecurity Working Group, a different type of look. And the reason we asked the Packer Biosecurity Working Group to get together was because Jim Lowe and Joe Connor organized, and Paul Yeske organized, and others, but they organized a survey of packing plants very early on. I think this started in June and went through July, a survey of packing plants simply to find out what was coming in and what was going out of packing plants in the Midwest. The reason we did that biosecurity group was because of this project. And what the project told us, bottom line, what the project told us was that essentially for every positive truck that goes into a packing plant, an additional positive truck comes out. It's really 0.7 positive trucks, but essentially that means that there's another positive truck that goes in. So every positive one that comes in, 2 goes out. That 2 includes the one that already came in. It also said that the drivers and the traffic through the packing plant was something we had to address, something we had to look at as an avenue of moving this virus around within the packing plants. And not surprisingly, the more contact there is, the more there is going on and off the trucks, and the more contact there is within the packing plant, the more likely the virus would be transferred within the packing plant. So subsequent to this, we got together a group of representatives from all the major packers, put them in a room like this and closed the door and said, what are we going to do? How are we going to handle this? What do we have to do? They agreed to form this biosecurity working group, and Dr. Hans Rotto shepherded these 3 groups through last year, working on the issues of security and containment and with these packing plants. Another thing that we did with the strategic task force was form the concept of a rapid response team. What we continually hear from the field is unexplained outbreaks that just don't seem to make any sense. And that's gone on through the summer, through the fall, and into this winter. And with USDA's help, a cooperative agreement with USDA, we put together a rapid response team that includes a USDA epidemiologist, a veterinarian investigator, separate set of eyes investigator, to go to different epidemiologically distinct outbreaks of PED and now Delta coronavirus, to take a look at those separately and try to figure out, using survey as well as some common sense look and investigation on site, additional samples, whatever has to be done in order to try to figure out as best we can why this epidemiologically distinct outbreak or infection happened. And Illinois was one. This is just the summary of the findings. This is the type of thing we get a report, and this is the type of thing that we get back with looking at the different possible inputs into these epidemiologically distinct outbreaks that is under the auspices of this strategic task force. We did another one in Ohio, again, just to show you the type of outcomes that we have with workers' vehicles and feed related, and this is really an epi look. It's not anything definitive, but this is the best guess we've got of these, again, I'll say it, epidemiologically distinct, because they just don't make any sense other than something's going on here. We've got to try to figure out what it is. That's another activity of the Strategic Task Force and this rapid response teams. The AASV survey that was done early on in this, and Lisa mentioned that essentially said that if you're going to look any place as an input of this virus, even though we don't know, but if you're going to look anywhere, you might continue to look at feed. And the rapid response team investigations have also said, let's look at feed some more. And so what we did was get together representatives of the feed industry. And it includes all the associations. It includes individual companies, USDA, FDA, veterinarians, and producers, nutritionists were all in a room a couple of weeks ago. And out of that, like the Packer group, we sat down and said, okay, here's what we know, or here's what we see, and we've got to figure out what we know, what we don't know, and how we can go forward in research and in communication about risks of feed if it's there. And Lisa showed you the research priorities that came out of that meeting. Also coming out of that meeting was a list of things that we all agreed that, here's what we know about this. Not human health or food safety, impacting farms of various sizes. PCR is important in assessing contact. Multiple methods of PED transmission, including environmental, transportation, feed systems, not just feed, but feed systems and other vectors. So the feed systems could include, and that's part of the investigation we're doing, could include feed components, could include feed processing, could include post-processing contamination. Those are the things that we came out of there with, and the reason we have this call for proposals out right now. That there are time and temperature, other things that we agreed upon, there are time and temperatures that could be effective. Post-processing contamination, I already mentioned that. And this disciplined research approach to attack PED. That was a positive meeting. It was a collaborative meeting, and I've got to give kudos to the feed industry and the nutritionists for coming together and working through this in a manner that we could make some progress toward those research priorities and try to answer the questions that need to be answered about the role, possible role of feed in transmission of the virus. Dane Goody from University of Minnesota with Bob Morrison have been doing a report of systems that have agreed to report their disease status on their farms. 680 breeding herds, there are 15 systems here, about 2.5 million sows are included in this report, in this group that says that's based on their PERS project that these systems all agreed, let's share PERS information back and forth so we know what's going on, at least within our herds, and we can assess some risk based on that. They also agreed then to do the same thing with PED, and they've done a very nice job of looking at this outbreak in a couple of ways. And I want to show you as a perspective of what's happened, because we get these other reports that sometimes can be kind of confusing, but as a perspective of what's happened in this. Okay, so the blue line is Midwest, the red line is Oklahoma Panhandle, the green is the Southeast, and then purple is the aggregate. Early on, this red line was the Oklahoma Panhandle, and that was the outbreak that happened very quickly, and it spread like wildfire. But then as we go, the next thing that was added was the Southeast and then the Midwest that adds to this aggregate line. So I want to point that out. You can't see very well, but about September is where we started. Outside of this Oklahoma Panhandle, about September is where we started getting more cases from Southeast U.S. Another look at this then, and this one to me is a really interesting one. This is the outbreak in Oklahoma that started. Here's September again now, where we start adding the Southeast and the Midwest to that mix, and that's the smooth line that is reported in this report from the University of Minnesota. So you can track and see, now this is within these systems, so I'm not telling you that it is representative of the whole U.S., but there are 2.5 million pigs in this. There's 680 herds. The interesting thing is that we had this outbreak, and through the summer this was low, and now through the winter we've hit peaks starting in November, again starting in February we've hit peaks. I don't think we did a very good job of communicating to producers and others that you can expect a PED virus like TGE, if we can call it like TGE a little bit at least. You can expect that the incidence over the summer is going to be low and it's going to increase over the winter. I don't think we did a very good job of communicating that to people, that it's going to happen. Now, the next thing we have to do is communicate to people that we also expect, I would expect, that next summer that grass is going to go back down again. And it's going to get low like it did this last summer. Following that, we can also expect that next winter it's going to go up. The question is going to be, is it going to go up this high? And if it goes up only this high, rather than this high, we've made a lot of progress. And we may be able to step this thing down. But that's a whole effort that's going to happen over the next year. So, PED. But the real deal is, what have we learned and where are we going and what's going to happen next? Because we've got at least 4 viruses that we know of within the last 18 to 24 months that have come into the U.S. that have been Chinese sourced, not necessarily come directly from China, but Chinese-related viruses. So we don't know how they got into the country, but we do know that these are Chinese-related viruses, and there's probably more. That's just an opinion. Well, I know of one more that's not reported yet, but we've got multiples that have come in. Whoops. So here's the deal. Here's the activity. And this is the summation of where we need to go next, and our plans for this year and our plans for coming into next year. It was an NPPC resolution and forum. The Pork Board had an advisement that fits in with this, but this really outlines the steps. First step is, if we know we're at risk from viruses coming into the country in some manner, let's try to do an assessment of our risks for that and our preparation. What viruses, for example, these other 4 came from China, Southeast Asia, originated in China, Southeast Asia. I'm careful about saying came from because we don't know how they got here, but originated from China, Southeast Asia. What other viruses or what other pathogens are there that we may be at risk at? Let's learn from history and say, if we got those others, what else might be coming? So we've got to learn from history and make an accounting of the other pathogens that could be coming and our preparation for those. PED on this list would have said that we don't know a lot about our preparation. We don't have adequate diagnostic lab tests, etc. for PED. What we want to do is look 6 months or a year or 18 months down the road and say, if we get one of these other pathogens, are we prepared diagnostically at least, or response-wise to respond to it? So that's the first thing. That's one thing that's very important, and we're working with AASV's taking the lead in doing that. The other is trying to figure out, to define the responsibilities of government, includes USDA, includes state, includes government, producers, producer associations, the associations in the whole pork chain in surveillance and response. Back in the day, in the pseudorabies day, we had a national control board, the pseudorabies control board. You sure don't want to call this a control board, but what it was a state, federal, industry cooperative effort to address a disease. And our concept is that we have to put together the same thing for these types of non-regulatory diseases. Should it be FMD or CSF, USDA's got command and control, and everybody knows the marching orders. Here with PED, what we found out is we didn't have a framework for our responsibilities, for state responsibilities, for federal responsibilities. That's going to be a big next step. Then, going along with that, strategies to respond and control or manage a disease, efficient sharing of information, and that's where the pork board's piece comes in, that for producers the issues become data security. And I don't use confidentiality. I don't use confidentiality anymore, because confidentiality implies that it's confidential and I'm not going to share it. Producers are not reluctant to share their information for disease control, for management purposes. What they want to know is they want to know what happens to it and how it's going to be controlled, how it's going to be safe, and who's going to use it. So it's really not data confidentiality, it's data security. And we've got to figure out this summer, we'll put together the working groups to figure out the processes by which we can provide producers with a framework for data security so we can share this information about non-regulatory diseases. That is a major lesson that we've learned from PED, and something that has been an impediment to our ability to analyze the disease, get ahead of the disease, and figure out how to respond to it. Finally, and maybe as important as anything, is strengthen the defense of the whole industry. And this isn't just a pork industry issue. Strengthen the defense of the U.S. agriculture to pathogens, to oversee pathogens that can come into the country. Our interest, of course, is the pork industry, but I can't imagine that that shouldn't be of interest to beef and to dairy and to everyone else as well. We're going to try to figure out these steps, make sure that these steps get addressed, and our hope and our plan is to come to USAHA with an outline and a framework for each one of these bullet points as we work through the summer.
Great. Thanks, Paul. A couple of questions.
Yeah.
Back here.
Yeah, real quick. The phrase going throughout the industry, there's two types of operations, those that had it and those that are going to get it. Can you respond to that at all? Because the general response across the countryside is yes. And they leave it at that.
Well, yes, that's a phrase, but I'll tell you what. This isn't a ninja virus. This isn't the ninja virus. We've got farms that have positive barns and negative barns on the same site. Within the universities, there are projects by which you've got a negative control, so you know they're clean. You've got a treatment, and you have a positive control, so you know they're infected. And there are people that go from negative control to treatment to positive control on one day, wash up, come back, come into the negative control barn or negative control room the next morning, and it stays negative. This isn't a ninja virus. We've got to, the implementation of biosecurity practices is so important. An example, and figuring out how it's transmitted. I mean, but an example, a couple of systems found some black light powder that was available on the internet. You know, it's powder that shows up in black light. They put it outside of their shower-in facility, on the floor. Put it outside of the shower-in facility on the floor. Told the workers that we're putting some disinfectant down over the weekend, and that's what this is. On Monday, they came back, and within the break room and the kitchen, they used the black light, and they found boot prints in the break room inside, in the break room in the kitchen. It wasn't footprints; it was boot prints that somebody had tracked through. This isn't Ninja virus. We have to have biosecurity, and we've got plenty of examples of successful biosecurity. If we implement that, I disagree with you're doomed to get it.